Welcome, welcome, welcome. Today, I'm excited to share some insights with a woman that has profoundly changed my world and given me just a deeper understanding of my own body and how how powerful chiropractic care can be for the nervous system. And as you know, we're busy women, we're trying to hold lots of different tabs open. And so I have the blessing to be able to introduce to you Dr. Irmarie Badenhorst. She's a chiropractor who's passionate about helping people move better, feel stronger, and live pain-free. And her path into this work her path in this into this work is genuinely personal. After a lower back injury left her dealing with chronic pain for over a decade, Irmarie was facing the prospect of surgery until chiropractic care changed everything. That experience gave her a deep belief in the body's ability to heal naturally with the right support. And it's this philosophy that drives her practice to this day. Originally from South Africa and raised in New Zealand, Irmarie trained at the New Zealand College of Chiropractic before building experiences across New Zealand, South Australia, Victoria, and regional communities through the Hunter Valley. And now she's settled in Newcastle, part of the team at Terrace Chiropractic in Raymond Terrace. A practice with long-standing focus on wellness and community, which is still going strong. Irmarie's approach centers on restoring balance to the nervous system so that the body can do exactly what it was designed to do. She's committed to staying current, expanding her knowledge every year to bring the most effective care to her patients. Outside the clinic, you'll find her staying very active, reading, catching up with friends and family, and making the most of everything that Newcastle has to offer. Welcome.
Thanks for having me. This is great. I'm excited and nervous.
Yeah. Yeah, look, well, that's probably the best place to start, isn't it? It's like having a little bit of nerves really just shows that you care.
Yeah.
Now, you and I have talked quite offline. You were probably one of the first practitioners that really really guided my knowledge into the spinal care and also how it plays a role so significantly in the autonomic nervous system and just the correlation between each vertebrae and organ systems, which, duh, I mean, I should have known that because really that's kind of the work that I do. But hearing you say it made me go, my goodness, I need to get on a podcast with you.
Yeah.
So a lot of women, they live with anxiety, tension, poor sleep, digestive changes, headaches and pain, but they don't really connect that it's all connected. Can you explain the role of the autonomic nervous system in all of these symptoms?
Yeah. So, like you were saying, it is one of those things where we should know about it and we should have been taught about it. And even though we do understand the basics of it, it's really hard when you're the person having the symptoms and seeking help from other practitioners and it just not being explained in the way that you understand it in that moment. But when it comes to your autonomic nervous system, there's two parts to it. So your fight and flight, which we've all heard about quite a bit, and your rest and digest. So your fight and flight is your survival, your go, 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 your stress response is your sympathetic part of that. And then your rest and digest is your parasympathetic. So it's your recovery, your healing, balance, resting. And us as humans, we're supposed to continuously kind of like flow through those states. However, we live in a very high stress world, a lot more demanding. And people tend to stay in the fight and flight mode for too long. And then that's why people will start to notice that they've got headaches, poor sleep, digestion, your muscles are tighter, your sensitivity to pain is increased. Your brain is kind of in this constant like alert mode because your fight and flight, like if you think back to caveman time, your fight and flight is like, I need to run away from this lion that's trying to chase me. So you're tense, you're tight, your digestion has to shut down. Your body can't digest your food right now. That's not a priority. It's let's get away from this. So when we're in that, so many things just kind of like weaken and shut down. And then that communication between brain and body gets worse. And when you're stuck in that for too long, that's when it kind of just snowballs into all of these symptoms, like from like your skin into deep into your cells. And us as women, like we tend to be more in that fight and flight because of work, because of life, when we've got children. The demands on us are quite more intense, and we are just generally more sensitive to emotions and symptoms. So it all just comes down to there is a stress in your system, there's an imbalance in your autonomic system, and that will lead to symptoms. Whatever that is so individualized for each person, but being stuck in that stress mode and then getting the symptoms is the sign of something's wrong. Let's do something about it.
So powerful. I think the thing that was really surprising for me is when we started to work together, you took a really clear baseline. So you had photographs, you showed me how my body was actually changing due to just incorrect postural practice.
Yeah.
And what was fascinating to me was actually, even as a practitioner, I hadn't linked that some of the symptoms that I was getting would be related to those upper vertebrae
Yeah,
issues.
in the neck. Yeah.
Yeah, and I mean, when you said it, I was just like, of course, that's all connected. And
Yeah.
what excites me is that I never understood the value of chiropractic care, and to have someone like yourself that's so knowledgeable. And what I find fascinating, I get on the table with you, and you're like, "Oh, your digestion's been off." I'm like, "I haven't told you anything. How does she know?"
Yeah.
And the fact that you can physically feel that in the connective tissue
Yeah.
is just fascinating to me. So,
Yeah.
what would you say that some of the most common symptoms or body symptoms are that you see that are related to those nervous system clues?
So kind of like you were saying, it would start with just something as basic as your posture. So with your posture, you're going to have muscles that get tight and muscles that get weak because you're just anatomically not where the body needs to be to deal with stress at the best way. With that as well, like you've got the tightness and the weakness in the muscles, ligaments, the joints will stop moving well. You'll get irritation around the nerves, and then that can lead to like a lot of the times up in the neck. That's when you're going to have like TMJ, jaw issues, clenching and grinding, headaches, poor sleep. In children, I tend to see it as like nightmares, but even in adults. In adults, a lot of the times, it's also energy, fatigue, emotional like regulation, brain fog. Like it's going to present differently in each person. Like if we're talking more like lower body, you can have lower back pain, but you can have reproductive problems. You can have digestion problems. You can have symptoms going down into your legs. You can have an ankle issue that's linked to your hip, which is because of your shoulder. Like it's all connected through the nervous system, communicating, right? And it's just like progressively over time you don't realize how much that stress is going to impact it. And then it just slowly starts to wear away because you get stuck in that position. Your body gets used to it. And then you're thinking, oh, what's wrong with my hip? Like, why do I have hip pain? Why is my pelvis tight? Why do I have bloating or gas? And it's like, it's not the food that you ate that's causing the gas alone. There's usually like multiple layers to it. And that's where it's like, there is no just one quick fix. It's going to be widespread. And that's what makes it so hard. And that's what we do is it's like I'm finding all the pieces to the puzzle. That's why we did the testing on the posture and then the balance and then your movement and then your muscles, ligaments, and nerves, because we've got to have all the information and also your symptoms to be able to figure out, okay, yeah, this is all linked and this is what we need to do to try and get it sorted. Like people will come in all the time with headaches and energy and sleep and jaw problems and back pain and shoulder pain and things like that. And it's like, okay, you've got symptoms. I'm just going to go and find what's the cause, right? Like I'm not going to just band-aid and adjust it and fix the jaw. We're not fixing the jaw. We're fixing the cause for why you have jaw pain or why you have low energy or why your back pain keeps flaring up even though you're exercising, that kind of thing. So Any symptom that you have is a signal from the brain, from the nerves, always. No matter if it's coming from the cell or the tissue or the organ or an old injury or the alcohol that you drank or the food that it's literally it's an internal and an external thing. And that's why when I palpate you and I feel, oh, your lower back is out, oh, your pelvis is misaligned, this is moving differently, I instantly go, what's going on with reproductive? What's going on with your digestion? What's going on with your sleep, your recovery? Like it's all connected, but it's a puzzle. It's always just building the puzzle.
Yeah, so good. I love that you say there's no quick fix because, in all honesty, we want that quick fix. We want that one thing that's going to do the thing. But I know for my own healing journey, I was so disconnected from my body in order to survive. Like I was having the most chronic symptoms and migraines and hospitalization of panic attacks. And for a long time, I didn't trust my body. And so
Yes.
one of the pieces of my journey has been this embodiment of my body with my spirit, my soul. And really, I think working with you over the last few months has really shown me there was one exercise that we did together, and that was based on one of the concerns that I came to you with was an exercise where you close your eyes and you walk. And I was blown away
Yeah.
because what felt like a straight line that I was walking in with my eyes closed
Yeah.
very much was a sharp turn to Albuquerque. And I was just, that really got my attention because I thought, my goodness, that there's a disconnect, and
Yeah.
so when there's a disconnect playing out in this nervous system, then that shows up as physical symptoms that you might have done some nutrition work, you might have done some exercise, you might have gone to your GPs and got your panels, but it's a holistic picture.
Yeah.
And I think most women do need to have a chiropractic doctor that gets it.
Yeah.
And so I'm so grateful that I've stumbled across your work and that we've met and that you know what you're doing and that you have this holistic view, which is just such a blessing. So for women over 35 or 40, like what changes start to happen in the body that can make them perhaps feel a bit less resilient, slower to recover, more anxious, or prone to pain?
So, women in general, like I was saying before, we are just a little bit more sensitive. Our systems, that's just how we were built. Unfortunately, though, I mean, it's not unfortunate. We don't have to see it as negative, but the body does create more sensitivity to pain. Our stress tolerance lowers. We notice more aches and pains in our joints and our muscles. Everything can get a little bit tighter. Our recovery just as humans starts to get less and less as we age. It's just faster, unfortunately, for women. Uh, we don't really bounce back as quickly from, bad sleep, stress, food, those kinds of things. I mean, everyone knows about the typical, the hangover gets worse when you get older. And it's like, well, yeah, it's a toxin that you're consuming and your body can't fight it off as well. And also your body is smarter to know, oh, this is really bad. Like I don't like this. And the hangover is like a symptom, a signal of yuck, I don't like this. Um, the other thing, of course, which is the biggest part of the female system, is our hormones. Our hormones fluctuate. We're consistently changing. Think of how we were when we were, 5 to 10 years old, then when we were pre-puberty, then as we're going through that, then we hit our 20s and we go into our 30s. There's always a change. And it's instead of fighting it, we kind of just need to take notice of it, support it. When we're injured, just be kinder to ourselves and understand this might take a little bit longer. Or you're stressed at work, you're stressed with the kids. You need to do a little bit more to bounce back from that. And addressing the symptoms before it becomes more and more of an issue. Uh, we tend to also, as women, push through. And I mean, a lot of people we just cope. We just, it's not that bad. Oh, it's just a headache. Oh, it's just a headache. It's like, oh, I can take a painkiller. Oh, I just need some more sleep. Oh, now it's a migraine. Oh, it's fine. It's fine. It's fine. And then it just builds and builds and builds. And it just has this like roller coaster effect on everything, right? And then it's more and more symptoms as we get older. And we think that we can still do the same as what we did 5, 10, 15 years ago. And it's like, no, you have to change with your body, support your body. Our cycle as a woman as well, when we're menstruating, is different from week to week. And it's like the more you understand and the more you are kind to yourself and don't fight it, the easier you get through, the better capacity you have in that given day or in that given week without it becoming this like battle between yourself and with the symptoms. And then the other thing, which unfortunately, I mean, I'm a woman, so I'm through this and I see it. I see a lot of women and they're all coming in with these symptoms that I'm like, this is probably your hormones. And yes, it's an issue. And yes, it's frustrating. No one wants to be in pain. No one wants to have these symptoms. But we fuel it by complaining about it consistently with each other because we love to chat. We love to gossip with our girls. We love to express what's going on in life. And it creates that connection with another human that us as women love to have. And it's super healthy. Like they've shown in studies, it is literally therapeutical to talk out your issues and concerns with each other. We're just missing that extra step of actioning on it. And then if it doesn't work, try something else. And if it doesn't work, try something else. Like we don't want to give up. We just have to learn from it and figure out a strategy that's going to work for us.
Totally. And the thing is, we're all so beautifully different. Like,
Yeah.
what works instantly for one person might take months for another.
Mm,
And I find that really fascinating in clinical practice. It's like there's 11 foundational priorities for healing. If you don't get the right one, particularly nutritionally, then you find that you're going around in circles. And I'm sure it's a little bit the same for most practitioner care. I think with chiropractic care, though, it's probably more obvious in a subtle way because it's presenting as pain.
yeah.
But again, you're looking at the body holistically. I
Yeah.
I love the way you explained it to me. When you drew sort of a bit of a roadmap and you said, look, this is what's going to happen in this period of time. And I
Yeah.
think the first window was really, it was 3 months. And then the
Yeah.
next one was 6 to 9 months to 12 months.
Mm,
And then the next one was 2 years. And so
yeah.
all of a sudden, instead of me going, I'm going to have one adjustment and feel better,
Yeah.
I started to think about, okay, well, if this was true, which I'm sure it is, because this is what you guys get taught about in your studies,
Mm,
and you see it in clinical care. Yes, some people might respond faster, but I need to have a longer term vision on how long it's going to take my body to bounce back. And of course,
yeah.
I've done the deeper work with removing inflammatory foods for my body. So I'd love to think that those manipulative corrections that we're having are holding
Yeah.
longer than they perhaps would if I was smashing myself with foods that weren't
Yes.
that
Yeah.
were inflammatory for my body. So
Yeah.
I guess my biggest question, hormones is a big one because people love to sort of say it's my hormones. And from a
Hmm.
functional nutrition lens, hormones are actually a consequence of things that are happening further north. So I guess my question
Yeah.
is, can hormonal shifts from a chiropractic care point of view, especially around falling estrogen, influence the nervous system and the joint stability and that muscle recovery or the tendon health in ways that women don't understand or realize?
Yes. And that's always a tricky subject to talk to women about. My lovely boss, Janine, she's helping train me to communicate better with people because it's it's a belief that we have in our body of who we are and what our symptoms are, and we're trying to teach people something they don't know enough about, right? And so when women are coming in and they've got dysregulation in their system, um, less stability in their body, their muscle recovery is slowing down, their tendon health is getting less and less, their bone density is getting less, they're much more sensitive to pain. Um, and they've got all of these symptoms that are coming, then it's like it just kind of keeps roller coastering, and it's like they don't realize how connected it all is to potentially their estrogen. And it's like, how do I, as a younger woman, talk to someone and be like, do you understand that this could be premenopausal symptoms? Because it's such a taboo thing to talk about, and it's a sensitive thing because the emotions around women going through that phase it's seen so negative, and it's like it's just a phase that we're going through, and we need to understand that as the estrogen starts to become less or just kind of like out of balance. And like you said, it's from the brain, like it's from there. You are going to notice that as that one drops, it affects everything else. It's not just the one hormone, it's not just your estrogen, but with that, your sleep quality is less, like your deep, your REM sleep, those cycles are less. And we know that with less sleep, that's going to affect everything else. You're going to have slower recovery. You're going to have tighter, weaker muscles, but it also, like the estrogen is also playing a role with that. And then with the estrogen, you've got your testosterone and progesterone that changes with it and has an impact on other things in the body as well. Like our moods. I think one of the most common symptoms that I tend to see with menopause is the anger. There's just this you're like, why am I so angry? Why am I getting these hot flushes? And it's like that's your hormones affecting your blood. It's like do you see the link? Do you understand how that's going to affect who you are? And it's also going to affect like how you feel, like your identity as a human, because for your 20s onwards, you were starting to learn your identity as a human, and then all of a sudden it starts changing, and you're like, I don't feel like myself. My moods are all over the place. My body feels wrong, like and you're fighting with your body, and you're angry, and then that anger just gets more and more, and then it affects your friendships, it affects your family, it affects everything. Um, and it is just that negative aspect that we tend to have around it. And it starts even in when we start PMSing, we see PMS as this negative thing that we just have to make jokes about or complain about with each other. And it's like those symptoms that we get, whether it's your joints are tight or they're weak or they're not moving well, or you're not sleeping well, or you're hungry or you're not hungry, it's all symptoms from your hormone system. And if there's a symptom that's not optimal or the best, it's a sign that the body needs support. And sometimes it's going to be, oh, I need to push it at the gym this week. And other times it's going to be, maybe I should just go for a walk, right? And it's like learning that and not being upset with your body that it's giving you these symptoms, just leaning into it, seeing how it goes, trial and error. Um, it's kind of like woman will be like, oh, why is this happening to me? Oh, why am I the one with all of these issues? Why is my headaches keep coming back? I've got people that have had headaches for years, years and years and years. And I remember once one of my mentors asked me, what was it? It was my back pain. She was asking me, how often do you get your pain? I was like, oh, like every day. I've learned about pain. I understand that pain is not normal, right? This is through my uni. And then when she asked me about headaches, all of a sudden my mind is not thinking of it as a symptom. And I said, oh, just like, yeah, just like the normal amount, maybe like one a week. And she's like, there is no normal amount of headaches. A headache is not normal. It is common. Pain is not normal, it is common. We've just made these symptoms that we feel, oh, that's normal to be weaker. Oh, that's normal to have brain fog. Oh, that's expected as a woman in menopause or an aging woman to have weaker bones. It's It's not normal. We've just made it common. And it's like us as individuals need to decide, oh, I don't want that though, and I can change it. Yes, it might take longer for some than others. And that is just purely exactly like you said. How much are you doing every single day that's helping you or making it worse? And I'd say it's like a scale. So
Yeah.
it's like, you, for instance, you're coming in for your adjustments. So we're getting your brain and body communicating better, right? That's focusing on one part of it to help your body adapt better to the changes it's going through. But then you're also working on eating well and sleeping well and moving and breathing and everything that you do. Like one night of bad sleep is not going to screw up your recovery, right? But if you're doing it consistently over many, many years, that's when it starts to make a physiological change in your system. And that's when the symptoms kind of set in and they become your new normal because you're just used to it. But we're not supposed to be used to it. We're supposed to listen to it and change.
I think it's really hard in this day and age when you're going through chronic health symptoms like the migraines and the headaches or PMS, which is, it's so common. And yet we get gaslit because one is that the first point of call is going and getting our pathology done. And quite often, I mean, for my own journey, it was very much that most of the test outcomes were normal. Now, that subset of testing is done on humans that aren't optimized. You don't go and get your blood work done when you feel fantastic.
Yeah,
So in
exactly.
terms of the averages of the data, like the data
Yeah,
set, where you've got to start to critically think, and that starts to then delve into, well, what is my body trying to tell me? And when I
yes,
started to look at my body through that lens, I just became way more open to solutions. I wasn't
yeah,
looking for another pill to fix the ill. I really started
mm,
focusing on foundational lifestyle solutions, which are
yeah,
free, and
yeah.
learning to
There is,
nourish myself. And then also just being more intuitive around my food choices.
yeah,
And as you said, sometimes I do feel like doing the heavy, hectic workouts, and then other times I feel like doing more restorative practices. So
yeah.
being okay that it doesn't need to look a certain way because I am
Mhm.
biologically not made to do the same thing every day.
No, 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 we're not.
And so the minute that I took that expectation off myself, I started to understand that some days, yes, are going to feel more natural and integrated and more able to do the harder work, and then other
Mm,
days it's okay.
yeah,
And so from that lens, I guess, could you explain the difference between, say, symptom relief and
yeah,
then the deeper true repair?
yeah,
And then I get, yeah, so I might get you to go there and then I'll break that question up into two. So can you explain the difference between the symptom relief and the deeper repair?
yeah. So basically, symptom relief is what you would think of like a painkiller. You've got a headache, you take a painkiller. The painkiller can help with the pain aspect of the headache. Because a headache is not just pain in the head, there is something going on that's causing it, right? So, relief is usually like we call it like band-aid care, plastic care. It's a painkiller, right? You're killing the pain part, whereas repair is creating those long-term changes to your body, to your structure, to your habits that's going to create the lasting change. So, and I mean, like, for instance, I understand medication is needed for certain things, but medication is still not fixing the problem, right? So it's like you've got, what would it be? You've got heart problems. Everyone's got freaking cholesterol and heart problems, and they're taking statins and things. That's not fixing the issue in the heart and in the diet and the effect the blood flow is having on the rest of the body. You can go and stretch and exercise the body, right? Because everyone wants to, be nice and fit and have good muscles and things like that. And you've got these massive gym people with these big swollen muscles, but they've got a postural or structural imbalance in the body or a disconnect between the spine and the core muscles or the nerves to the glute muscles. So it's like, yeah, you're making these muscles look strong, but they're not functioning strong. They're not firing the way that they're supposed to. So it's something that you have to work on long term, right? Versus just a quick one-off, like you were saying, like a one-off adjustment, one-off massage, a one-off acupuncture, or even a few. It can still give you relief, but it's an expensive, expensive painkiller. That's what we tell people. And that's why when I start my testing, like I did with you, when we got into the physical exam side of your consult, the first test we do on everyone is that balance one, because it's like, okay, we're going to be doing tests for the pain, but I'm actually going to be testing for the function and where it's coming from. And the balance test, your eyes are closed, your brain and body are communicating, and you're supposed to stay in a nice spot. If the brain and body communicate well, you stay nice and still. If there's dysfunction, you move, and people get lopsided, they twist, they start walking into our cute little skeleton in the room. And I can adjust you that day. I can adjust, generally it'd be in the neck, but it can be from the hips, anywhere. And we can redo that test and you can do better. And you might stay a lot closer to where you originally started. However, that's not going to last. It's not going to stay like that because the body's used to the prior dysfunctional state that you've been in for 5, 10, 15, 20 years. So a one-time pill can give you relief. A one-time stretch or exercise to improve your balance can last, but how long is it going to last? And if you don't continuously do something, what's going to happen? How bad is it going to get? You know?
Yeah. I remember now looking at the trajectory of my posture, I'm naturally chin more forward than not. And then so now I'm becoming a lot more aware, again, this embodiment piece of
Yeah.
now that I've stacked the micro habits, I know how to
Mm,
nourish myself, I know how to hydrate myself, I know how to exercise, I know what my body needs at this age bracket. And
mm,
then we throw in and we add in the micro habit of the chiropractic care and we do that for a period of time and then we build on that. And now I'm starting to notice, okay, I'm hunching, I can feel that my hips aren't in alignment with my shoulders when I'm sitting. What can I do to fix that or
mm.
correct that longer term? And
Yeah.
then as you and I were talking yesterday, it's like, what could I do intermittently with my desk? And you gave me a few tools and tips
Mm,
around some functional movement that I could do to really enhance the flexibility of my spine to sort of, I guess, reset it is how I
yeah.
like to look at it. It's like I've
Yeah.
been sitting in this posture for a while and I can feel it in my body. Now, what do I do? And so I
Yeah.
love that your approach is, multifaceted and that it is the long game. So,
Mm.
why do women need to understand the longer timeline of recovery if they want lasting change other than that band-aid?
Um, the reason why is if we don't have the symptoms, we don't think there's a problem. And so we'll go through life and we do the things that we do, our hobbies, our habits, those kinds of things. And it's in every aspect as you as an individual, everything that you do. And when we're in our younger years and we maybe don't eat as well or sleep as well, or we've got injuries and things like that, it builds and builds and builds. And slowly, slowly, the body starts showing you symptoms. And sometimes it can be 5, 10, 20 years till symptoms start showing up from something that's actually been developing. And they create patterns in your body that your body gets used to. It's not that it's normal and the ideal, it's just that we get used to it. So that's why as soon as I gave you that awareness in your report appointment of everything that I found and how it's connected, literally they've shown in like scientific studies, the more awareness you have of why you feel the way that you feel, where it's coming from, the better you can actually start to change because it's those little habits that you do. But if you've had you know, 10 years, 20 years sitting working at a desk, your internal structure changes and gets stuck like that. And that's its new normal. And it can't comfortably or naturally switch from the fight or flight or the rest or digest and do the actions that it's supposed to and adapt to stress the way that it's supposed to. And then we ideally want quick fixes, but it's like, well, if you've been sitting with hunched posture and your head has been too far forward, right? We know that that's going to weaken a lot of the muscles towards the front, which is kind of going to just draw you in even more and round your shoulders and pull onto the traps in the back where we always feel that tightness into the shoulders that runs all the way up into the back of the neck, all the way down the spine. So if that's been like that for 10, 20 years, a one-time adjustment or massage or stretch and exercise isn't going to fix it, but the little habits that you do every single day to help with that will change it. But it's just understanding that it takes time and it's the consistency. Consistently, how much are you doing to make it better? How much are you doing to make it worse? Is this scale balanced? Like, are you working on the way that I always say it is the KISS, keep it simple, stupid. So it's like eat well, sleep well, breathe well, think well, move well. Do a little bit for each of those consistently over time, and you'll notice the changes a lot faster. But if you are also just consistently doing things each day to make it worse, then it's just going to take longer and longer and get worse and worse.
Yeah, totally. Yeah. And so for me, I would say that I'm pretty healthy, but at the time that I came in to see you, I was getting some headaches and I was having some visual disturbance, and I thought, oh, well, maybe that's just because I've hit 45 and my eyes are changing. Um, and a low-lying tinnitus that I've had for quite some time. And then when you explained to me, actually, no, in that sort of upper thoracic, it's really quite common that
Hmm.
the all of those, and I was just like, here I
Yeah.
was just thinking that that had to be my normal. But it wasn't until I really sat with it and I could see, okay, these things are connected, and it's important to me to have a long, vibrant life because we do get to choose
Mm.
simple, sustainable, keep it simple style solutions, and we need to choose health
Yeah.
because otherwise, what's the alternative? We don't want to get
Yeah.
old and be decrepit, right? So,
Yeah.
how do I guess what two more questions? So, what is something that you're really excited about with the direction that you're going with your work?
So for me, it's quite a big, exciting time. As you said in the introduction, I trained in New Zealand, did my internship there, and then moved over to Australia on my own, which was exciting. And then worked through Newcastle and Hunter, then got to travel and do some locum work. And through all of that, I was like, okay, I'm ready to come home. I'm ready. I'm ready to settle. So Newcastle is home now, which is really awesome. And then I was lucky enough to find Terrace Chiropractic with Janine and Kelly, and it all just worked out so well. It was this just kind of like fell into my lap, like everything that I wanted in a practice, in a community, and something that I can see myself in long term. And now that I'm like a bit more settled, just getting involved with the community, I'm doing a house talk to some rugby league players tomorrow night. I'm doing the girls first and then eventually, hopefully, doing it for the boys. Teenagers, just kind of trying to teach them, like, you're young now, like, please learn from my mistakes and like take care of your health now rather than pay for the price later. I'm doing a lot of exciting and really intense training around communication for work. A lot different to what I got taught and what I've done for the prior like 5 years. So really excited about that because it's things like this, like trying to educate people about things they know about, but they don't fully understand it. And it's like you've got to embody it. you've got to get through to each individual so specific and specialized um, to get them on that health journey that we're trying to do for everyone, get more into that preventative, corrective type care. And then doing a lot of new training for the adjustments that I do, a specialized program, Syntropy training, that the adjustments in there are a lot better designed for facilitating the adjustments in the body to respond better anatomically and neurologically. So people should get results a lot more efficiently and effectively per person, regardless if they're a slow responder or a fast responder. And yeah, very exciting.
That's interesting. Slow responder and fast responder. And so
Mm,
even that layer of category you can see clinically, and people get
yeah,
frustrated, but ultimately we're all biologically different.
yeah.
So where do people find you?
So we've got a really good website that allows people to book online, which, given this day and age, some people really don't like doing phone calls. So that's really awesome. And then we've got our social media. We've got Instagram and Facebook, which we are trying to get a little bit up and running now that I'm part of the team, which is fun because we don't really like photos and videos, but we're changing with the times and we'll start putting some cool things on there. We're in Raymond Terrace on Gleneagles Street in really, really, really nice community there. And yeah,
Awesome. Well, thank you so much for sharing your wisdom and your vision for, what you see in the community and that education and communication piece that I know you're expanding on. I can see incredible things for where you're going, and I'm just so blessed to have stumbled upon another person to have in my toolkit to help me restore and maintain,
yeah,
my well-being
yeah,
for my physical body and my mental health, right? Because
yeah,
that's the big piece here. It's like if you've ever
mm,
struggled with mental health, you've broken free, then you really do want to maintain those restorative practices so that you never go back there again.
yeah, yeah,
And not from a fear place, but just from I'm choosing this lifestyle. So thank you
yeah.
so much for your time. I feel really
Thank you.
blessed, and I'll put all of your links in the show notes.
Awesome.
Awesome. Okay.
Thank you
Thank
so much,
you.
Sally Ann.
Awesome.